Hello, good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Medi-Cal Behavioral Health Student Loan Repayment Program launch webinar. Here's today's agenda. We're going to do some housekeeping and some introduction, followed by some opening remarks and an overview of HCAI. Then we'll get into the Medi-Cal Behavioral Health Student Loan Repayment Program webinar objectives. From there, we'll give you an overview of BH Connect and the workforce initiative associated with it. We will jump into the Medi-Cal Behavioral Health Student Loan Repayment Program overview, and then we'll have some questions and answers at the end. And then we will conclude today with some closing remarks. Jumping into our housekeeping, let you know that this webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. We're trying to answer as many questions as possible today, but we may need to defer some situation-specific questions to the grant guide, and we will be also providing our email address for you to ask questions if you don't get your question answered today. And lastly, this webinar will be recorded and will be available within 5 business days. And with that, it is my pleasure to introduce Kim Ramson, Grants Management Section Chief for Health Workforce Development, for our opening remarks.
Great, thanks, Chris. Good morning, everyone. My name is Kim Ramson with the Department of Healthcare Access and Information, and I work in Health Workforce Development. And I want to thank you all for joining us today for the BH Connect Medi-Cal Behavioral Health Student Loan Repayment Program webinar. We're excited to have so many of you with us today. Our first webinar was in high demand and we had a great turnout. So we're glad that we were able to schedule this second webinar and that so many of you are willing to join us today. As you all know, California is facing a significant behavioral health workforce shortage, and the BH Connect Workforce Initiative is one way we're working to address it. In partnership with DHCS, or Department of Healthcare Services, this program seeks to expand the number of behavioral health professionals who are delivering services to Medi-Cal members and uninsured clients. The program is designed to support and retain behavioral health providers, particularly in high-need communities, by helping to reduce the burden of student loan debt. Today's webinar is designed for potential applicants to learn about the program and application process. We will walk you through the key aspects of the program, including eligibility requirements, application timelines, award amounts, and how you can apply. I do want to note that due to time and the amount of interest, we may not be able to answer all of your questions during this presentation, but we will do our best. If you have any additional questions for us after this webinar, feel free to reach out to us via email and send us your questions. Again, we are grateful for your time and interest, and we hope you find this webinar helpful. So let's get started. Okay, so HCAI's vision, a healthier California, where all receive equitable, affordable, and quality healthcare. And our mission is to expand equitable access to quality, affordable healthcare for all Californians through resilient facilities, actionable information, and the health workforce each community needs. We have 5 program areas we are proud to support at HCAI, and those include facilities, financing, data, affordability, and workforce, which is what we are focusing on today, to expand and diversify California's health workforce for underserved areas and populations. Next slide. The work we do here at HCAI enables the expansion and development of a health workforce that reflects California's diversity while addressing supply shortages and inequities. We do this by administering programs and funding and publishing actual data about California's health workforce and training. Our programs cut across 4 areas: behavioral health, which we're focusing on today, nursing and midwifery, primary care, and oral health. Our prevention strategies develop, support, and expand a health workforce that serves medically underserved areas and Medi-Cal members and reflects and responds to the needs of California's population. We offer programs that provide financial support for organizations building the workforce pipeline, organizations expanding educational capacity, individuals pursuing health careers, and organizations supporting providers and addressing retention. Okay, so let's get into the webinar objectives. Next slide. Thank you. We are going to provide you with a high-level overview of the BH Connect Workforce Initiative and provide relevant information to potential applicants of the Medi-Cal Behavioral Health Student Loan Repayment Program. And next, we're going to give a quick overview of the BH Connect Workforce Initiative. So we received federal approvals to transform behavioral health care in Medi-Cal. This program is federally funded and supported. In mid-December, the Department of Healthcare Services, or DHCS, received approval from the Centers for Medicare and Medicaid Services, or CMS, for the BH Connect initiative. BH Connect seeks to transform California's behavioral health delivery system by expanding access to highly effective community-based services, strengthening the behavioral health workforce, and ensuring Medi-Cal members receive high-quality care. CMS approved key elements of BH Connect through a new Section 1115 demonstration and a series of new state plan amendments, or SPAs. So there are quite a few goals of BH Connect noted here, all very significant, but I won't read through all of these. Instead, I will focus on the highlighted goal, which is why we are here today, to strengthen the workforce needed to deliver community-based behavioral health services and evidence-based practices to members living with behavioral health needs. Next slide, please. So the Workforce Initiative will support the training, recruitment, and retention of behavioral health practitioners to provide services across the continuum of care within the Medi-Cal safety net, serving Medi-Cal members and the uninsured. Over the next 5 years, DHCS and HCAI will partner up to invest up to $1.9 billion in 5 workforce programs, which we will touch on in a bit. The recipients of this funding will need to make a 2 to 4 year commitment serving Medi-Cal members. And in the event we don't expend all the funding, the state may carry over unused dollars from 1 year to the next. So we will have the ability to redistribute some of these funds across the different programs if DHCS and HCAI decide to make that decision. So these are the 5 workforce initiatives we plan on opening between now and the next year, year and a half. The student loan repayment, which is open now, what we're discussing today. We'll also have a scholarship program, a recruitment and retention program, a community-based provider training program, as well as a residency training program, which actually opens next week on Tuesday, the 15th. So we're very excited about that as well. And with that, I will pass it over to Christian to get a little more detail about the student loan repayment program. Thank you.
Hello, friends. I am Christian Jones, policy analyst here at HCAI, and I am the policy lead on the Medi-Cal Behavioral Health Student Loan Repayment Program, and I'm going to provide an overview of the program. Next slide. So the goal of this program is to expand the availability of behavioral health professionals in Medi-Cal safety net settings by alleviating student loan burdens and incentivizing people to practice in those settings. We have up to $90 million in total for this year's MBH SLRP cycle. There will be follow-on cycles. This is a program that we plan to have multiple cycles for. So this is not the only opportunity for funds. And it awards up to $240,000 in loan repayment, depending on your profession. And these amounts are set by the BH Connect special terms and conditions. That is the agreement that we have with the federal government to administer these programs. An important note is that a grantee cannot receive more loan repayment than they have in eligible student debt. So if you have $120,000 of eligible debt, you cannot receive more than $120,000 in an award. Next slide. These are the eligible professions for this loan repayment program: addiction medicine physicians, AOD counselors, associate clinical social workers, marriage and family therapists, professional clinical counselors, certified peer support specialists, certified wellness coaches, community health workers, licensed clinical psychologists, clinical social workers, marriage and family therapists, professional clinical counselors, and licensed psychiatric technicians. Also licensed vocational nurses, mental health rehabilitation specialists, nurse practitioners, occupational therapists, physician assistants, psychology associate, psychiatrists, including addiction and child addiction psychiatrists and child and adolescent psychiatrists and registered nurses. I appreciate all the hearts that people have while I run through all of those. Next slide. Here's the max award and service obligations by profession. So the maximum award is determined on the basis of your profession, and also how the amount of service obligation that you get is determined on the basis of your profession and the amount of money that you receive. So for the first category, addiction medicine physicians, addiction psychiatrists, child and adolescent psychiatrists, nurse practitioners, physician assistants, and psychiatrists are eligible for up to $240,000 in loan repayment. And regardless of the amount of award that you receive, you would serve a 4-year service obligation if you are in one of these professions. Similarly, if you're an associate clinical social worker, an associate marriage and family therapist, professional clinical counselor, the licensed version of any of those professions, a licensed psychiatric technician, a licensed vocational nurse, occupational therapist, a psychological associate, or a registered nurse, you're eligible for up to $180,000, and you also would need to serve a 4-year service obligation. Finally, if you're an AOD counselor, a certified peer support specialist, a certified wellness coach, a community health worker, a mental health rehabilitation specialist, you are eligible for up to $120,000 of an award if you're declared eligible. And your service obligation is dependent on how much money you are awarded. So if you're awarded more than $20,000, it's a 4-year service obligation. If you are awarded between $10,000 and $20,000, it's a 3-year service obligation. And if you are awarded less than $10,000, it is a 2-year service obligation. Next slide. So all service obligations must be served full-time. I'll get into that in a follow-on slide, but they must be served full-time in a Medi-Cal safety net setting, which the standard terms and conditions, the agreement that we have with the federal government, defines that as the following: a federally qualified health center, a community mental health center, a rural health clinic, or settings with the following payer mixes. So a hospital with 40% or higher Medicaid or uninsured population served, a rural hospital with 30 or higher Medicaid and or uninsured population served, or other behavioral health settings with 40% or higher Medicaid or uninsured population served. Next slide. So other behavioral health settings is a broad category. It contains a bunch of kinds of different sites. They're all listed here. I'm not going to run through all of them, but these are listed in the grant guide, just as they are here. I will note all of these settings, if you are in one of these settings, has to meet the definition of the other behavioral health setting in the previous slide, which is once again serving 40% or higher Medicaid and or uninsured population. Next slide. So our full-time employment policy. So once again, in accordance with the agreement that we have with the federal government to administer this program, we cannot permit a grantee to work less than full-time in a Medi-Cal safety net setting during their service obligation. We define full-time as a minimum of 32 hours per week providing direct client care, or 30 hours per week of direct care in a school-based behavioral health setting. Direct client care includes behavioral health services such as prevention, early intervention, assessment, treatment, counseling, procedures, patient self-care, patient education, and documentation related to those patient encounters being treated by or suspected of needing behavioral health services. Direct care also includes face-to-face care and telehealth-based care and first-line supervision. Now, we don't have the definition of first-line supervision here, but it is in the grant guide. The definition of first-line supervision is if you are supervising somebody that cannot deliver direct care without your supervision. So, for example, in a behavioral health setting, you might have a peer support specialist. A peer support specialist under the state plan needs to be supervised by somebody like a licensed clinical social worker. So for that licensed clinical social worker, they are providing first-line supervision to that peer support specialist. If the peer support specialist is delivering direct services and the supervisor of those behavioral health services is a licensed clinical social worker. To fulfill the full-time requirement, you may work at one setting or multiple settings. So you might work at a variety of different sites or a variety of different employers. As long as they are all eligible Medi-Cal safety net settings, you may work at multiple organizations to fulfill this 32-hour or 30-hour requirement. Next slide. And with that, I will pass it over to our wonderful program officer, Jessica McIntyre from our grants management team.
Hello, everyone. My name is Jessica. I'm the program officer for grants management. Thank you, Christian. Next slide, please. I'm going to go over the key dates for this program. The application is currently open. It opened on July 1st of this year. And the deadline to apply is August 15th at 3 p.m. Our anticipated award notice date is November of this year, and our proposed grant agreement start date is in December of this year. Next slide, please. And I'm going to go over what you need to apply. Your National Provider Identifier or NPI number, if you have one. Your license or credential or certification or registration associated with your eligible profession. Your unofficial copies of your college or university transcripts that document your education was a prerequisite for your profession. Copies of the latest loan statement for every loan that is specifically associated with your above education. Information for 2 emergency contacts or additional contacts. These are people we'll contact if we have trouble reaching you. And if applicable, a conflict of interest letter. For instance, if you have been a state employee in the past or currently work for California Community College, University of California, or State University of California. Next slide, please. The application components, there's 11 sections. The first is affirmations. The second is licenses, associate registration, certification, etc. The third is education. 4, service obligation. 5, conflict of interest. 6, employment. 7, loan information. 8, additional questions. 9, additional contacts. 10, profile information, and 11, confirmation. Next slide, please. I'll go over the employer verification. In the application, applicants must provide a contact for their employer. This contact will be sent an email asking them to fill out an online employer verification form. This form will be used to identify or to determine site eligibility of the applicant's profession, and compliance with the full-time work policy. Your application is not complete until your employer returns the employer verification form. Please ensure that you give your employer enough time to complete this form. And those who are awarded will have to submit an employer verification form every 6 months. Next slide, please. And now I'll go over the post-award and payment provisions. Payments will be made directly to the grantee's loan servicer, not the grantee. The payment will be issued sometime between December of this year and December of next year. The grantee is responsible for paying their loan obligations before the award payment is issued and must continue making payments if there is a remaining balance. The grantee must notify HCAI immediately of any changes or delay in completing their service obligation. HCAI expects the grantee will begin performance of their obligations on the start date in the grant agreement. HCAI cannot provide any tax advice to the grantee. HCAI are not tax professionals, and tax consequences may vary depending on the grantee. For this reason, grantees should seek professional tax advice. I want to mention I've seen some hands. We'll go over questions and answers at the end of the presentation. Next slide, please. The breach policy. So HCAI will recoup all payments made on behalf of the grantee if the grantee fails to perform service and other grant agreement obligations. HCAI acknowledges that the service commitment associated with this program may be extensive, up to 4 years. Applicants are therefore encouraged to carefully evaluate their personal and professional goals prior to entering into a grant agreement. In the event of a breach of the agreement, the grantee will owe the entirety of their award back to HCAI. Except in very limited circumstances, HCAI is unable to waive a service obligation after the payment to your loan servicer has been issued. Please refer to pages 23 and 24 of the grant guide for the waiver policy. Next slide, please. And now I will go over the evaluation and scoring procedures. Next slide. The application evaluation criteria includes the following items. Languages spoken other than English is a max 15 points. Prior participation in a publicly funded government program is 20 points max. Prior experience working in a Medi-Cal safety net setting is 10 points max. HCAI identified shortage area is 5 points max. Employment at a Medi-Cal specialty behavioral health site operated by or contracted with a county behavioral health agency is 20 points. And HCAI intends for these funds to support a geographic and setting or market type distribution in California. Applicants seeking to support geographic regions and setting or market types not addressed by other applications may receive preference. HCAI may also give preference to applicants who provide Medi-Cal specialty behavioral health services. Next slide, please. And I'll go over our resources. Please visit our website. We have many resources available. You will find the grant guide, the technical assistance guide. We'll soon be posting an FAQ, which is in development. There's an informational flyer, and we will be uploading the recording of this webinar. Next slide, please. And now I'll pass this back to Chris for our questions and answers.
All right, thank you so much, Jessica. As you can see, our team has put a lot of hard work into this program, and we're excited that you've joined us today to learn more. We're going to transition into the question and answer session. In the menu bar at the top of your screen, you can find the chat feature, and we ask that you type your questions into the chat. I do see some hands raised. We are going to ask that people do the chat so that we can make sure we capture all of the questions today, even if we don't get to them. We have a lot of people online with us today, but we will do our best to answer as many questions as possible. We do ask that if you have questions specific to personal circumstances, that you email our team at mbhslrp@hci.ca.gov, and we'll add that in the chat so you can get to it. And that way we can best assist you with those types of questions. We do endeavor to respond to all of the outreach within 2 business days. However, we are having a pretty high volume of outreach regarding this program, so responses may take up to 5 business days. We do ask that you be patient with us on that. Before we get started here, I do want to introduce our panel. We've got Lindsay Bradshaw, one of our BH Connect program managers, who will be joining me to help facilitate the Q&A session. Then we have Christian Jones, our policy analyst for behavioral health and policy. Then we also have Julie Hudman, Assistant Deputy Director for Behavioral Health from DHCS joining us, and Jessica Castellon, Health Program Specialist from DHCS as well with us today, and we're so grateful to have all of them. So we're going to jump into questions, and like I said, we're going to do everything we can to get to all of them. So starting out here, how do I know if the agency qualifies? What questions do I ask them during the interview to find out? And do you have a link to any agencies?
Thanks, Chris. I'm going to pass this one to Christian.
Yeah, so we don't have a link to particular agencies because the only way that we determine whether you work at an eligible site is once we have all the information that you submit in the application, and then after application submission, we can assess whether it's an eligible site once we have all of the applications. But some questions you might ask, do you serve Medi-Cal clients? What percentage of Medi-Cal clients do you serve? And ask what kind of site would you be working at? That's the key things when determining the eligibility of a site is are they serving the right kinds of people? So for most sites, it's a 40% payer mix. That's the threshold of Medi-Cal and uninsured clients that you have to be serving. For some sites, it's 30%. And then for some sites, they auto-qualify because of the kind of site that they are. So I would refer you to the eligible sites in the grant guide and probably show them, hey, are you one of these things that's listed here in the grant guide, and see if they can help you.
Thank you, Christian. Sage asks, I'm curious if an employment and training counselor would qualify for this. This is a county position assisting CalWORKs recipients who also receive Medi-Cal.
I'm going to start with Christian on this one, and Christian, if you would like to pass it to DHCS, feel free.
So the key thing there's three things that have to occur for you to be eligible for the program. You have to be working in an eligible profession. So that would be the first question I asked you. What is the profession of the job that you're serving? Are you a behavioral health provider, as we defined it here, and all of the nice providers that I've listed before? The next question I would ask is, are you delivering behavioral health services as a part of your job? Normally, just helping somebody with CalWORKs would not be delivering behavioral health services, but perhaps I misunderstand what happens at CalWORKs, and maybe you are delivering behavioral health services. I don't know, but the requirement is up to 32 hours of direct client care when you're outside of a school setting that you have to be delivering per week. And then, is it an eligible setting? Is it one of the eligible settings that we listed on one of the slides here and also in the grant guide, serving the right kind of payer mix, or one of the settings that auto qualify? So that's kind of going to be true for all of the eligible setting questions that we receive, is those three elements: eligible provider, providing eligible services on a full-time basis, and then at an eligible site.
All right, thank you, Christian. Audrey asked, do 40% of my personal clients need to be on Medicare or uninsured mental health population, or is it 40% of the total clients in my facility practice?
I'm going to pass this one to Christian.
Oh, sorry, yeah. Being rude to Lindsay. So you said Medicare in your question. I'm assuming you mean Medicaid. This payer mix refers to Medicaid, or Medi-Cal as we call it in the state. So it's if we're talking about what counts, it's the total clients at your facility or practice. Because if it was only like your personal clients and not just your site, we feel like you could probably game that, where you could just take say your site serves 5% Medicaid clients, but in order to receive loan repayment, your boss just assigns you all the Medicaid clients. And we don't feel that that's a good way to administer the program, so we take it at the site level.
All right, thank you. Catherine asks, I applied, but I'm concerned that I didn't know how to answer if I had a Pell Grant. I had one, but it was during my undergrad degree. Does that still count? If so, how can I amend my application? And I think we have a couple questions on updating applications once they've been submitted.
Jessica?
Hi, yes, we will allow you to update your application prior to the application close deadline. Send us an email explaining what you need to update, and we will do that for you. We are confirming that functionality will allow us to do this, so it might take us a little while to get back to you and confirm that you can update your application.
All right. Do we have an answer regarding the Pell Grant, if that was in the past?
I think the Pell Grant at any time you can include that and say yes to that question.
That's correct.
Perfect. All right, thank you. Maria asks, what happens if someone is awarded this and then goes on maternity leave?
I will pass that to Christian.
So in the grant agreement, which is a part of the grant guide, it's the bottom of the grant guide, so a lot of scrolling. But we have the circumstances under which you can take leave and the circumstances under which you can suspend your service obligation. So we'd have to, maternity leave is obviously an eligible circumstance under which you are temporarily taking leave. So I'd encourage you to read that section, but we allow up to 4 weeks of leave taken without penalty per year. So 4 weeks for any reason. That can be vacation, that could be maternity leave, sick leave, 4 weeks for any reason throughout the year. And we don't extend your service obligation if you take time off for those that 4 week period. And then there's circumstances under which you can be granted a suspension of your service obligation. So and we list those particular circumstances in the grant guide. I would encourage you to email your individual circumstance, like, when you're having a baby, all that stuff. And we can plot that against the timeline of when you're signing agreements, when you're serving your service obligation. But If you get a suspension of your service obligation, we will extend the end date of your service obligation while your service obligation is suspended. So during the suspended time, you don't have to work. You can take care of whatever the situation that is going on in your life that warranted the suspension. And then when you go back to work, you can retake up your service obligation. And then you're not held in breach, you're still awarded. We will extend that end date of the service obligation for the length that we suspended it.
All right, thank you. Next question. It sounded like private practice would not be a qualified setting. Is that correct?
Christian?
So private practice would be an eligible setting if they're serving the eligible payer mix. There's plenty of people that have a private practice but serve Medicaid clients. We'd encourage you to email your individual circumstance, but we don't categorically reject private practice from eligibility.
All right, thank you. Again, I do see hands being raised in the meeting. We do ask that if you can, please use your chat feature to ask your questions. And if you're not able to access the chat feature for some reason, sometimes institutions will have that blocked due to their security policies. We ask that you would email us your questions at mbhslrp@hci.ca.gov. Next question. Number one, how do we ensure our job site meets the Medi-Cal requirement? And number two, for time off vacations, are we able to make up those hours to equal 32 hours in a week within the working month?
Christian, for both of those?
So the first question, we can't provide you like a yes or no prior to you submitting your application and us going to the verification process. You can email your individual circumstance and we can give you a general sense, but we can't give you a yes or no before our full-on verification process that occurs after the application. I would encourage you to read the grant guide as it relates to eligible settings and then perhaps converse with the program director or your supervisor as to what services are being provided at your site and the type of populations that you serve. For time off, as I said previously, you can take up to 4 weeks off a year. Doesn't matter if you're taking that off 4 hours in one day, 2 hours in the next, or if you're taking it off days consecutively, you can take up to 4 weeks off a year without penalty. We recognize that people go on vacation and that's a normal part of having a job.
Perfect, thank you. All right, Dr. Nicole asks, what documents can be submitted for those in the process of working towards licensing for psychology, but was not required to register with the Cal Board due to being exempt?
I'm going to start with you, Christian, on this, and you can pass it to Jessica as needed.
Yeah, I believe this has to do with waivered psychologists. I would encourage you to email your individual circumstance as it relates to this. Because waivered psychologist is a really complicated scenario, and it's much easier to handle that question over email.
All right, thank you. Yeah, go ahead and email us at that MBH SLRP email address. Next question, Alexander asks, hello, I'm a state employee with the Department of State Hospitals. I was told that employees under Cal HR do not qualify due to bargaining. Can you please clarify this issue? Thank you.
Thanks. I'm going to have Jessica and/or Nathan support this one.
Nathan, can you take this?
Apologies, I just noticed my camera's on. Hi, everyone. I'm Nathaniel. I'm a program manager here over MBH, SLRP, and other BH Connect programs. And unfortunately, I need to get the question repeated.
No worries. I'm a state employee with the Department of State Hospitals. I was told that employees under Cal HR do not qualify due to bargaining. Can you please clarify this issue?
That is correct. Effectively, anyone collecting a paycheck from the state of California as an employer, working under Cal HR, is not eligible for the program because it is considered a conflict of interest. This is a state-run program, although federally funded. So we cannot award state employees, the concern being there might be some kind of preferential treatment or other conflict of interest. So unfortunately, you would not be eligible for the program.
All right, thank you, Nathan. Daisy asks, can we receive financial support if we haven't accumulated much debt through loans? I'm a peer support specialist in Medi-Cal system, and I'm currently seeking my degree in psychology.
I will pass this to Jessica.
Hi there. So the reason for this program is to repay your student loans. So if you have some debt in student loans, you can apply and we can pay off that amount. But maybe this is not the program for you if you're currently a student. We do have other programs available. Scholarship programs are intended for current students. Take a look at our website.
I will add that, as we discussed earlier, the BH Connect Scholarship Program that'll be launching next year for people that will be at school for fall 2026. So I would encourage you to stick with us and sign up for our updates because we will have some scholarship programs launching to support people who are seeking a degree in psychology.
Thanks.
All
And
right.
Jessica, can you add clarification regarding how this program is only for previous debt, not currently accumulating debt?
Yes. So eligible debt is the debt you have for your current eligible profession. So if you're currently a peer support specialist, then debt incurred in becoming a peer support certified specialist would be the debt that you could submit for this program.
All right, thank you all. Next question, Marie asks, can you change agencies within your commitment time?
Jessica?
Yes, you can. If you are still working in an eligible setting, providing eligible services, working in an eligible profession, definitely communicate with us about the plan to change jobs.
All right, thank you. What does the point system mean?
I'm going to ask Eric to support this one as I interpret this to be regarding the scoring.
Sorry, hi there, everybody. Eric Munoz. I'm the Research and Evaluation Branch Chief here at HCAI. We do assign scoring to our grant process to basically prioritize how we award funding. So scoring breakdown is in the grant guide. If you have any further questions about that, I can go more in detail, but it is in our grant guide there. Jessica, I don't know if you have anything to add on top of that.
No, I think that explains it.
All right, thank you, Eric. All right, Angelica asks, do any prior years working in a Medi-Cal setting count for the 4-year obligation?
Jessica?
So we do appreciate your past experience, and if you take a look at our scoring and evaluation, your past experience might strengthen your application. However, this program is requiring a future service obligation that will start in December at the time of the beginning of the grant agreement.
Thanks, Jessica. David asks, what if you have gotten help from another program with loan forgiveness, in this case, a wet loan repayment program?
I'm going to pass this to Nathan.
Yeah. So we do have a restriction that you cannot accept multiple service obligations at the same time. But if you've received any kind of loan repayment grant from another loan repayment program or even a loan forgiveness program, that shouldn't conflict in any way as long as the service obligation associated with that award is completed by the time the service obligation associated with this award begins. That's the real determining factor there. You just can't have two overlapping or conflicting service obligations. Oh, and you do still need to have eligible debt, of course, to be eligible for this program.
All right, thank you, Nathan. Caitlin asks, if we've received an HCAI funded grant through our workplace already, are we still eligible for this one? The payments are from our company directly instead of from HCAI. Sounds like this is one of the CBO grants.
Yeah, I'll have Nathan answer this as well.
Believe the same logic will apply. Again, what we look at is, eligibility in terms of site, in terms of discipline, and having eligible debt. And then we need to make sure that you don't have conflicting service obligations. So I'm hearing that, the award from this is paid by your employer or your company, not directly from HCAI. But if there's a service obligation associated with it, that would still be considered a conflicting service obligation. That rule holds true regardless of the entity that is funding or making payments for your existing loan repayment program.
All right, thank you. Brianna asks, I was a state employee but quit in June 2025 and came to the county. Would having been a former state employee make me ineligible?
Nathan?
No, former state employees are not necessarily ineligible. We will likely require a conflict of interest letter from you, specifically attesting to the fact that you are no longer employed by the state of California, but former employment is not a blocker for eligibility.
All right. Nancy asks, can I be a 1099 to qualify?
Nathan or Jessica?
So that's an independent contractor. You might qualify.
Yeah,
Christian,
that's
do you
going to
wanna
be
add?
dependent on who's cutting the paycheck, I think, specifically.
Yeah. It will depend on who's cutting the paycheck, where are you working, the same three criterias that I've been. What are you an independent contractor for? What are you doing as an independent contractor? What profession are you in, and who are you serving? But we don't categorically reject independent contractors. Plenty of county contracted people are independent contractors that are contracted with the county to provide services, and this program is for people that do stuff like that.
I will add this situation may also require a conflict of interest letter, just a personal attestation saying that you are not collecting a paycheck or employed by the state of California, just to be clear.
All right, thank you. Katrina asks, am I obligated to pay state or federal taxes if approved?
Nathan, do we have an answer to this?
HCAI does not provide tax advice, so we would encourage you to take a question of this nature to a tax professional, but we cannot provide any kind of tax advice regarding the awards we offer. So,
All right, thank you. Let's see here. Next question. Sorry, there we are. Can there be a service obligation modification if you have a scheduled maternity leave planned within the 4-year requirement? I know we've answered this one before, but we'll go ahead and get that out there one more time.
Christian?
First, congratulations on the baby. If the baby isn't coming, I didn't say that to the past person, so congratulations. I think that's the most important thing to reflect. But yes, so there is a modification provision for people who are experiencing a temporary disability, which being pregnant is a temporary disability that might make you unable to work. We also have a leave provision for at least 4 weeks. So I would encourage you to reach out with your individual circumstance for when are you planning on having a child as it relates to the program timeline so we can best serve your needs. But congratulations on having a child if you have one on the way.
All right, thank you, Christian. Once again, my questions got moved on me. It jumped. Let me find my place again here. Apologize for the delay here. I see a number of questions asking if we can get a copy of the slides. We will be posting the slides on our webpage, and you'll be able to find those again within the 5 business days. We'll have the slides and the recording up. Okay, here we go. I'm having a hard time getting this verification filled out. County uses third-party Vault Verify. How can I get my application verified?
Jessica, can you support this one?
Can you email us mbhslrp@hci.ca.gov? We can help you further in problem solving.
All right, thank you. Do I need to provide employment verification for every agency included in my work history or just my current employer?
Jessica?
The employment verification is for your current employers that you are going to be submitting for your service obligation. So if you work in more than one place currently to make up the full time, then you might be submitting more than one. If you only work at one place, then you'll just be submitting one.
All right. Yeah, this keeps jumping on me. This is not a normal feature on how this chat works, but it's just
Yeah.
jumping all around on me today. Okay, here we go. How can we determine if our federal loans are eligible when they are consolidated?
Jessica?
1 second. So consolidated or refinanced educational loans could be eligible. They must clearly delineate the original loans and the degrees conferred. They cannot be consolidated with another individual's loan or with non-educational loans. And failure to provide this information may result in eligibility for the program.
All right. Another one that I keep seeing in the chat is where do we go to apply? You can go to the resources that we have pinned on here. You'll see Medi-Cal Behavioral Health Student Loan Repayment Program. There will be a link right off of that. We'll repost those in the chat for you. Okay. And it jumped once again on me. This is getting really ridiculous. All right. Apologize again. This has never happened before in a webinar.
I'm experiencing the same, Chris. I think if you go to the chats from 11:24, that's where we left off.
Yes, I just found it. Thank
Okay.
you. Yeah, it's really strange Microsoft moment here. Who determines the award amount, and does the EVF need to be sent to you by your employer, or do we upload the copy signed by our employer? Thank you.
Jessica?
So the awarded amount, maximums you may have seen in our previous slides. So it depends on your profession. And then also the maximum is the maximum eligible loan debt that you have for your current profession. So you'll be submitting a loan statement or more than one loan statement if you have multiple loan servicers. Sorry, what was the other part of that question?
Does the EVF need to be sent to you by our employer, or do we upload the copy signed by our employer?
So it's an electronic online form that will be sent to your employer when you submit your application.
All right. Thank you. Diana asks, is this loan only for people who have completed their specialty?
Christian?
I'd have to know more about your individual circumstance. So it's for people who are in an eligible profession. So there are some people who have not completed their professional journey but are in an eligible profession. Like a case in point would be like an associate clinical social worker is not a licensed clinical social worker yet, but is also an eligible profession. So we'd have to know more about your individual circumstance.
All right. Thank you, Christian. Lorraine asks, if I am completing my BA in December 2025 and rolling over into my MA, will I qualify? I've yet to make any payments on my loans as I am not done with my schooling yet.
Jessica?
So if you apply in an eligible profession that requires a BA, we could consider your student loan debt for your BA. If you were able to be working full-time in an eligible site, an eligible profession starting in December, you would need to have information about your work site. And if you're not currently working, then you would need to submit an offer letter that you will be starting to work by then. However, if you are going into an MA program, then you might want to wait, or you might want to look at our scholarship programs because we wouldn't be able to support covering any loans related to that.
Thank you, Jessica. Claudia asks, what sort of documents would you approve for a loan statement? Ed Financial does not have loan statements.
Jessica or Nathan?
Jessica, do you want to talk about the loan statements themselves? I'm actually looking at Ed Financial right now.
So Normally, you would be wanting to upload a loan statement from your loan servicer. You might have more than one, so you might be uploading, more than one submission for each. As far as not having loan statements, maybe there's a screenshot. I'm not sure if that's might be what the situation is, but maybe you can email us more information.
Yeah, I'll chime in and say we might need more information. I'm not personally familiar with Ed Financial. I can see that they are a servicer for, federal student aid. But looking at them, they look almost like they might be a pass-through, like they're a servicer and not actually the holder of your loans. So you may need to double check who actually holds your loans and obtain the lender statements from that other party. But this would be a good one to email us, MBH SLRP at hci.ca.gov, so we can dig into it a bit further.
All right, thank you. Next question. If I am in a loan forgiveness program already, am I still eligible?
Jessica?
So it would kind of depend on what that program was. As we mentioned previously, if you have a conflicting service obligation, you would need to successfully complete that obligation before you could apply for this program. If you're referring to the public service loan forgiveness program, that one is not considered a service obligation, and so it does not conflict.
All right. Ray asks, I have one loan statement for my loan. Oh, sorry. Skip the question. Carmen, does the verification of employer go to the immediate supervisor or HR?
Jessica?
So it would be the person that can best verify your employment hours, providing direct service, your site type, your site's NPI. It could be HR, it could be your direct supervisor. You might send it to one of them and they might need to communicate with someone else to get all the information they need.
Alrighty. Audrey asks, where can I see the eligibility criteria for group private practice employees who provide Medicare services?
Toss up. Christian?
I will once again say the program relates to Medicaid, serving the Medicaid population and the uninsured population, not the Medicare population. I don't know if that's a typo because I make that mistake probably every other time I type the word Medicaid. I type Medi-Cal or I type Medicare. So if that was a typo, I totally understand. But if you only provide Medicare services and you don't serve the Medicaid population or the uninsured, you're not going to be an eligible person for this program. But if you're serving Medicaid population and the uninsured, I would check our grant guide and just see whether one of the site types that is listed in the grant guide is referred to you or the site that you work at, and whether you are in an eligible profession.
All right, thank you, Christian. Can you go back to the slide that showed all the application requirements?
Chris or Alma, I guess, whoever is running the slide deck, if you guys want to go back to a slide, and I don't know, Grants, if you guys can determine what number that is to support.
I'm not sure if they're referring to slide 25 or 26. One of those is what you need to apply, and the other one is application components.
I think we can also point out that the webinar deck will be available as a resource on our web page. If there's anything in the webinar you want to review, that'll be freely available for you to take a look at later.
That seems like we're gonna.
Are we able to go back to slide, what was it, 25? All right, well, we're working that out. We'll move to the next question and figure out what's going on there.
I will point out, Chris, for the Ed Financial person, there's a lot of people in the chat providing some technical assistance for you to get your loan statement. A number of people also have Ed Financial, so just check the chat. There's actually a lot of people that are would love to help.
Thanks, everyone.
You love to see it.
Yeah. Thank you, other humans, for helping other humans.
Yes, indeed. We love it. All right, what qualifies as a school-based site?
Christian?
So this is a school site that delivers eligible Medi-Cal behavioral health services. So this could be through LEA BOP. You might be an LEA BOP school site that delivers eligible behavioral health services through LEA BOP, or you might be a participant in the CYBHI fee schedule cohorts, and you're delivering eligible Medi-Cal covered behavioral health services via the CYBHI fee schedule. Please email your individual circumstances if that's not clear, and we can assist.
All right, thank you. Luis asks, I applied for to get my ACSW number, but have not received it yet. Would I need to have it before I apply for the program?
Jessica and/or Christian?
I assume you mean the associate clinical social worker number, and you do need the associate registration and number to apply. You do have until August 15th at 3 p.m. to get your application in, so maybe we'll get it in time. If not, we do plan to have another cycle of this program next year.
All right, thank you, Jessica. Shannon asks, if my employer loses Medi-Cal funding or I need to find an alternate position, does the 4-year time frame pause, or is there a time frame that we need to secure alternate qualifying employment?
Jessica?
Definitely reach out to us if that happens to you. I believe we give you 6 months. Is that right?
That is
And
correct.
back me up.
Yeah, so loss of program funding is one of the conditions under which we would grant you a suspension for you to go and find alternate employment. You will have to go to an eligible site afterwards. So bear in mind, if you think your program might be defunded or you think that your job is not secure, I would hazard that against, I would tell you to just consider that as you apply. This is a 4-year service obligation, and we do have to be quite strict about recovering funds if you breach that service obligation. We don't want to do that. We don't want to do it to you. It's bad for us. It's bad for you. So just consider that as you apply. But we do give a 6-month time span if your program loses funding or if you lose your job through no fault of your own.
Okay, sounds good. Thank you. Victoria asks, what is the likelihood of someone receiving a funding award?
Nathan?
Sorry, was on mute. This is going to be dependent on a number of factors, including primarily just the number of applicants we get compared to the available funding. You know, we are looking to provide awards to everyone we can, and there isn't a minimum score cutoff or anything like that for the awards. We will be making our award determinations based on overall scoring and available funding, but ultimately this is a difficult question to answer until we've seen the final count on the number of eligible applications that are submitted. So.
All right.
And I will add, we have a lot of money for this program, so we anticipate giving out a lot of awards. So do not be intimidated by the number of people here. This is a big program, and we have a big applicant pool to match. So we definitely encourage you to apply.
Larger than I think any program we've done of this nature before. So.
Absolutely. Which is why we're excited that you are all here with us today. All right. Sarah asks, can I apply if neither I nor my company has an NPI? I have a BH role in my company that doesn't focus solely on BH. I saw a few questions in the chat about not having an NPI, so hopefully this will answer a few questions for people.
Yeah, I'm going to pass this to Christian.
Yeah, so for most providers under the Medicaid system, it is expected that you have a national provider identifier because you need that to provide reimbursable services. There are some limited exceptions, and you can email your individual situation and we can discuss that individual situation. But most people individually will have an NPI. The site NPI is dependent on the kind of site that you have. Would love to discuss your circumstance. It seemed like through your question that your role isn't in providing behavioral health services. So I would remind you that the program requires 32 hours of direct care be be provided by you every week on average, or 30 hours in a school site if that's your place of employment. So just email us your individual circumstance. MPI is a complicated thing for individual providers and site types. So would love to hear your individual situation.
All right, thank you. Seeing a number of questions about if the student loan is under a parent's loan. Were you able to speak to that?
Nathan, are you able to speak to that?
I might need Christian to back me up, but I don't think that will qualify. Typically, these federal loan repayment programs require that the loans in question be taken out in your name. So stuff like Parent Plus loans are not eligible for these programs. Christian, is that accurate?
I would refer to the grant guide. We have a very beautiful table in the grant guide that lists the kinds of loans that are eligible. I would just refer people to that page because even I cannot memorize the entirety of that table. But Jessica probably has it up. I can see here. Oh, there you go, girl. You got it.
I'm looking at it right now, and it's very clear that your loans need to be in the name of the applicant.
We are working on trying to get slide 25 up still. We're having a technical difficulty on that. But we are trying to get that going here. There we are. Let's go back to that question. Jessica, did you want to speak through this one more time? Back to the question of
asked about the application requirements. So this is the list of requirements needed for the application. They didn't ask any more information, I don't think.
I think they asked for the eligibility criteria as well.
The next slide.
This one was the application components, the different parts of the application.
All right. Okay, and as a reminder, we are going to get the slide deck out. It will be on our webpage along with the recording within 5 days. Alma, thank you for working through that tech problem, getting us to slide 25 there. Let's see, Angelica asks, how do we verify that we have the 32 hours per week work at our sites? What if there's a week where we have more cancellations or no-shows in community mental health?
Jessica?
So the requirement is 32 hours of direct client care per week. You are, able to take off, as we mentioned, for weeks per year if for some reason you need some time off, but we aren't going to penalize you for not having a client at a certain time of day in your work day. That answers the question.
Right. Generally speaking, we're looking at 32 hours per week on average. We recognize that people may sometimes work a bit more or work a bit less. Any kind of extended leave from your employment would be handled as an extension. But when it comes to the ongoing verification, we are looking at weekly averages.
All right, thank you. Jeremy asks, what if a provider is contracted to a California County Behavioral Health Center, technically employed by and paid by a different company, but working full-time at the Behavioral Health Agency? And what if that provider lives outside of California, but works full-time for a California Behavioral Health Center through telehealth?
Christian?
So I'll take the first part of your question. We don't care how you come to be working at an eligible site. We just care that you are working at an eligible site. So you could be contracted with the county. You could be an independent private practice person that takes county clients. You could be a direct employee of a county behavioral health agency. That's totally fine. So that's the first half of your question. Second half of your question, we have listed in the grant guide a linked telehealth policy that describes the circumstances under which somebody can be a Medicaid rendering provider via telehealth and be located outside of the state. It's very limited circumstances. In general, we require that somebody be licensed in California and be living in California to be a part of the program. But you might qualify under, it's a behavioral health, it's a BIN. I don't know what that acronym is, but there's a BIN that was issued by DHCS that we have linked directly in the grant guide for that circumstance.
If I can jump in real quick regarding being contracted to a California or really any eligible site. If you're contracted to an eligible site by a third party, it's true we don't look at that as a factor for eligibility for this program. But as has been mentioned previously, the breach penalties for this program are very severe. And speak from experience, we do see situations where any eligible provider contracted with a third party may find that that third party, moves them to another ineligible site. And in that circumstance, that does often result in breach. We do require that you return to employment at an eligible site. So if you are contracted to an eligible site through a third party, please do keep that in mind when applying for this program or accepting an award from this program, because these breach penalties are unfortunately very severe.
It's a good call out, Nate. Thank you. All right. Audrey asks, for the 32-hour-a-week requirement, how many of those hours need to be direct contact with clients for an LMFT? Can notes, scheduling, and other tasks count towards the 32 hours per week? I'm wondering if, as an LMFT, do I need to have 32 sessions per week with Medicare clients to qualify for the grant?
Christian?
So we list documentation related to patient encounters in the definition of direct client care. I'd refer you to that definition. It's in the grant guide. But you do not have to be literally sitting in front of a client for 32 hours a week. We recognize that that's not how delivering behavioral health services work. You need time for documentation. You need time for case management. You need time for working with the entire care team that might be related to a client. And we include all of that in our definition of direct client care. We also include direct first line supervision. So as an LMFT, you might be supervising a peer support specialist that's also providing services. So I would just encourage you, we do have an expanded definition of direct client care. It's not just being face-to-face in the moment with a client.
All right, thank you. Ronnie asks, are there any resources available to help or assist applicants with filling out the applications, such as walking to someone how to fill it out?
Yeah.
Jessica? Or Nathan?
Yeah, sorry.
Go for
I believe it was just yesterday, uploaded our technical assistance guide to our website. So you can refer to that guide for a walkthrough on how to complete the application. And if you do have any questions, of course, you can always send us an email.
All right, thank you. Gianni asks, can family medicine primary care physicians who do MAT apply?
Christian?
We would need to know your individual circumstances to answer that question. Also, I don't know what MAT is, full disclosure, so excuse my ignorance.
Medication-assisted treatment.
Medication-assisted treatment. Yeah, I would need your individual circumstances because I need to know more about, where are you delivering this care, to whom, all of that stuff. So again, the three criterions are eligible provider type, eligible direct client care services provided full-time for at least 32 hours or 30 hours in a school setting, and then being delivered at an eligible site.
All right. Next question. If we get scoring points for working in prior eligible settings, should we submit our resume or CV as a part of our application? Can we send this as proof of prior work experience? I did not see this part of the application components. Apologies if I missed it.
Jessica?
So we aren't accepting resumes for proof of past experience. There is a section on the application that asked about your past experience, and you can fill in information on that page.
All right, thank you. Can a student with an internship qualify for this program?
Christian?
Sorry, repeat the question.
Can a student in an internship qualify for this program?
Most likely not, because as an intern, you wouldn't be delivering the necessary 32 eligible direct client care hours. If for some reason your internship is delivering that amount and you're an eligible provider type and you're in an eligible setting, then you might be eligible. If for some reason your internship is for that long, I would encourage you to email your individual circumstances.
Rusty asks, the requirement stated payment must be made before the grant payment will be issued to the loan provider. What if a loan is in forbearance?
Jessica?
So forbearance is acceptable. Loans need to be in good standing. So we don't consider that as not in good standing. Deferment is also acceptable.
To that, the stipulation that payments must still be made towards the grant payment, that's a stipulation letting you know that you are expected to continue making your regularly scheduled payments to your loan providers, in addition to the award that is paid towards your loan if you receive an award. We ask that you do not rely on the award as your sole means of paying off these loans. And of course, because the timing of the award payment to your loans may not coincide with the timing of required payments that you make personally, it doesn't replace those required payments. So you do need to continue making those payments, even if you receive an award, until you are out of debt.
All right, thank you. For the emergency contact section, is it asking for personal contacts or professional contacts?
Jessica?
So these are additional contacts that we can contact if we have trouble reaching you. So most likely it's a personal contact. It could be a professional contact.
I would say personal contacts are preferable. This is in the event that there's any kind of issue or concern with your application, or if you're awarded your grant agreement and we need to reach out to you and we cannot get a hold of you, we will reach out to these additional contacts you provide. Professional contacts can be a little iffier in this regard, because one of the issues that might arise is you have left that employer and they can no longer get in contact with you either. So we do prefer personal contacts.
All right, thank you.
I'll also add that we use those contacts, like say if we're having an issue, like you're an awardee, there's an issue getting you your money, and maybe you mistyped your email to us, so we can't contact you. So this is just what we use in general for all circumstances in contacting you in an emergency. And we'd appreciate you just listing somebody that we can contact, because we want to get you your money, and contacting you is one of the necessary things we'll have to do that.
Sounds good. Thank you. All right, next question. If I supervise licensed staff and unlicensed staff and I do not provide direct client support, can I still apply and qualify? I'm a licensed LMFT.
Christian?
So direct client care, as we define it, includes what's called first line supervision. So first line supervision is supervision that you provide that is necessary for somebody else to deliver other things under the direct client care definition. So a peer support specialist delivers direct client services. They need to have maybe an LMFT supervise them in order to provide those services. That's first line supervision. So it would depend on the nature of the supervision that you're providing to these staff members, and if you're doing at least 32 hours of it a week.
All right, thank you. I know we've already answered the question about the needing the associate number, but the second part of this question, not sure if we've answered. Can I apply for this even if I am receiving the DMH stipend?
Nathan, are you familiar with this?
I just Googled it, familiar with it. So it does appear the DMH stipend might involve a service obligation, as it does require that you work at specific eligible sites. If it has a specific service obligation attached to it, that service obligation would compete with the service obligation associated with this program. And I mean, that holds true even if the site you're working at fulfills both service obligations. We simply can't have competing service obligations in play here. So the DMH stipend, you'd want to make sure, double check if you've got a service obligation associated with that. If you do, you would be ineligible for the program.
Let's see. Currently with Mohela, I haven't received a recent statement from them in months, and also I'm unable to contact them to request one. Can I submit the last statement Do I need an MPI number from, MPI number from my company work, or does it have to be individual? And is my official transcript, will that work? Not the unofficial.
Jessica and Nathan.
So the first part, maybe Nathan can, if they haven't received a recent statement,
Generally, Mohella should make these available to download online. You shouldn't necessarily need to contact them. If you don't have a more recent statement online, perhaps because your loans are in forbearance or deferment, yes, submit the most recent statement you have, and we'll review that. And if we have any issues with it, we will reach out to you and give you the opportunity to correct those issues during the review process. MPI number, I believe we actually require both your individual and your company's MPI, your employer's MPI for this program.
If you don't have an individual one, you don't need to include it. We do require it if you have one, and we do require it for your organization.
Thank you, Jessica. And then, yeah, I mean, we request you upload unofficial transcripts only because those are easier to get a hold of. But if you only have an official one, that is totally fine. Feel free to upload it.
This question is from Ellen Lopez. Can a response survey be amended or resubmitted? As I believe one of my SUD therapists had many more qualifying hours than he thinks. I believe this one is an email us and we'll get it taken care of, right?
Yep.
Yes, email us, please.
All right, so Ellen, go ahead and email MBH SLRP and we'll help you out there. Let's see. If selected, the disbursement between December 2024 and 2025, I think those dates are probably wrong, will be for the entire amount of submitted loan?
Yeah, assuming that these dates are meant to be between December 2025 and 2026. Jessica, can you take this one?
Yes, so we'll be working with your loan servicer, and if you are awarded, we will be paying up to the maximum for your profession and up to the maximum of your eligible loan debt at the time of payment.
So to clarify, that means it's your total eligible loan or your total maximum award, whichever is lesser. If you have more eligible debt than the maximum loan, we will not pay off the entire submitted loan. So just do keep that in mind. And then again, we ask that you continue making payments even while you're waiting for reimbursement, the grant award.
Okay. Let's see here. We're starting to run out of time, so I'm going to start making sure that if there's any unique questions. I am seeing a lot of questions that are very specific to your circumstances, not likely to be common to most people's. Again, if you do have those sorts of situations, just email us at that mbhslrp at hci.ca.gov.
I have one I'd like to call out if I can,
Please.
Chris.
Yes, please do.
Angelica Solario asked if we do a year and have to change jobs, if we get partial grants to us or nothing at all until we do 4 years of MFT. You are required to fulfill the complete service obligation. That's the full 4 years. So if you do a year and swap to another eligible employer, that might involve an extension to the service obligation to make up for the missed time. But otherwise, you would be in good standing and payments would continue to be made toward your student loans. However, if you do a year and then have to change jobs to outside eligible employment for this program, you would not receive a partial grant. You would actually be found in breach for being outside of eligible employment, and you would have to return the money paid towards your loan so far.
Thank you for calling that one out. Does more points equal more money awarded and less points equal less money awarded?
Eric? If he's still with us. And if he's not still with us, Jessica.
Is
Oh, he's there. Okay.
Sorry, got me a second. Sorry, Chris, can you read that one more time?
Does more points equal more money awarded and less points equal less money awarded?
No, I don't think the award is based on the points. The points are just a way of tiering the applications in our award making decisions. Christian, Jessica, anything to add on top of that?
So more points means more likely to be awarded.
And that's basically it. We do not currently have any plans to base your award amount on your score. This score is just kind of a yes, do you get an award? No, do you not? Kind of evaluation.
All right, thank you. On the application, there's a space for your license or credential. I don't have that because I'm just a community health worker. Am I still eligible?
Christian, can you answer this?
Jessica, can you help me out here? I
Yeah.
remember we have a solution for community health workers, but I
So
don't remember.
I believe community health workers require a community health worker certification, and that's what it's going to be asking for in the application.
And Jessica, I believe it's that the certification, it would be like a certificate that you received from your training program. So maybe the word certification is not
Right.
is not quite the right one to use, but an upload of your community health worker certificate that you received from your training program.
Not just a community health worker. We love our community health workers around here. So you do an important job, and we definitely love supporting them.
Fantastic
Okay,
point.
Anthony asks, I'm not really sure how to go about getting my school transcript since the school closed down 10 years ago. What should they do?
Nathan, do you have advice on this one?
Do not. I'm sorry, if you could pass us an email about this, we can try to look into it, but I am not sure how to get transcripts from a school that is closed down. I don't know what entity would be responsible for keeping those records.
I think sometimes they pass those records to a different school, but yeah, we might need to look into it.
Yeah.
I believe there are some state resources that we can research and offer for folks who are trying to get transcripts from schools that are closed.
All right. Let's see. Does the time payback begin once approved, or does it include time you have already accumulated service to the required population?
Sorry, can you repeat that, Chris?
Does the time payback begin once approved, or does it include time you have already accumulated service to the required population? So I think what we're asking
Jessica.
here, yeah.
Yeah, I got it. So as we mentioned before, past service is appreciated and may strengthen your application if you look at the scoring in the application on the grant guide. However, we are requiring a future service obligation for this program, which will start in December at the beginning of the grant agreement.
All right. Well, I think we are pretty much out of time for all of these questions. And really do appreciate everybody's questions today. If you weren't able to get your question answered, please email the team at mbhslrp@hci.ca.gov. As we've mentioned before, and we do want to make sure that if you still have a question that you do get it answered, so go ahead and email us. Again, we are getting a lot of email.
Oh.
We'll hand it back to Kim for some closing thoughts, and then we'll wrap up our webinar here.
All right, great. Thanks, Chris. And thank you all for joining us today for the BH Connect Medi-Cal Behavioral Health Student Loan Repayment Program webinar. We hope the information shared has given you a better understanding of the program's goals, eligibility requirements, and overall application process. Do want to stress that the BH Connect program is more than just a loan repayment opportunity. It's a broader effort to strengthen and support California's behavioral health workforce, particularly in communities where access to care is most needed. So we really encourage all eligible professionals to consider applying and to share this opportunity within your networks. On behalf of our team and our partners, thank you again for your time, your commitment to behavioral health, and for the vital work you do every day to serve individuals and families across California. It's really appreciated. And now I will turn it over to Chris to wrap us up.
Thank you so much, Kim. Well, once again, we do appreciate everybody joining us today to learn more about our Medi-Cal Behavioral Health Student Loan Repayment Program. We are excited to be able to offer this as not just a part of the BH Connect initiative, but as a part of our health workforce development efforts at HCAI in total. We're grateful for your participation with us today. As a reminder, the application period closes on August 15th at 3 p.m., so don't wait to get those applications in. We would love for you to follow us online. Obviously, we would love for you to go check out our website and see everything that we offer, because it's more than just this program. We'd also love for you to follow us on any of our social channels. So if you're on one of these channels, please follow us. And as you're doing great work around the programs, especially if you do get awarded, please tag us with one of these hashtags and let us know the work that you're doing there. We would also love for you to subscribe to our monthly newsletter. You can go to the link here. You will find the subscription list and make sure you subscribe for anything on the checklist that says health workforce. It's under that health workforce category, and you will be added to our monthly newsletter letting you know all of the health workforce things that we have going on in that month. Our contact information is there. As we mentioned, please email us. That's the best way to get a hold of us, and we will get back to you as soon as we can. And with that, we thank you so much for attending today. We conclude today's webinar, and we hope you have a wonderful day. Thank you.